Lung cancer is a type of cancer that begins in the lungs and can spread to other parts of the body. It is one of the most common and serious types of cancer, often associated with smoking, though it can also occur in non-smokers. Types of lung cancer: non-small cell lung cancer and NSCLC. Adenocarcinoma, the most common type of NSCLC, usually starting in the outer parts of the lungs. It is more common in non-smokers and women. Squamous cell carcinoma typically begins in the central parts of the lungs, such as the bronchi. It is often linked to smoking. Large cell carcinoma, the less common type that can appear in any part of the lung and tends to grow and spread quickly. Small cell lung cancer (SCLC), the less common but more aggressive type of lung cancer that starts in the central part of the lungs and spreads rapidly. It is strongly associated with smoking. Risk factors: smoking, the leading risk factor for lung cancer. The risk increases with the number of cigarettes smoked and the duration of smoking. Exposure to secondhand smoke. Non-smokers who are exposed to secondhand smoke are at increased risk. Exposure to carcinogens. Occupational exposure to substances such as asbestos, radon, and certain chemicals can increase risk. Family history. The family history of lung cancer can increase risk. Radiation therapy. Previous radiation therapy to the chest can increase the risk of lung cancer. Air pollution. Long-term exposure to high levels of air pollution may increase the risk. Symptoms of lung cancer can vary depending on the stage and type but may include persistent cough, a cough that does not go away or worsens over time. Chest pain, pain that is persistent and may worsen with deep breathing or coughing. Shortness of breath, difficulty breathing or a feeling of breathlessness. Hemoptysis, coughing up blood or rust-colored sputum. Wheezing, the wheezing or raspy sound while breathing. Unexplained weight loss, losing weight without trying. Fatigue, persistent feeling of tiredness or weakness. Loss of appetite, reduced desire to eat. Diagnosis: medical history and physical examination. Evaluating symptoms, smoking history, and overall health. Imaging studies. Chest X-ray, initial imaging to look for abnormal areas in the lungs. CT scan, provides detailed images to assess the size, shape, and location of tumors. Biopsy. Bronchoscopy, a procedure using a thin tube with a camera to view the lungs and take a sample of tissue. Needle biopsy, the needle is used to obtain a tissue sample from the lung. Surgical biopsy, the surgical procedure to remove a part of or the entire tumor for examination. Molecular testing, to identify specific genetic mutations in the cancer cells that may influence treatment options. PET scan, to detect if the cancer has spread to other parts of the body. Bone scintigraphy, used to check if the cancer has spread to the bones. Stages of lung cancer: Stage I, cancer is localized to the lung and has not spread to lymph nodes. Stage II, cancer may have spread to nearby lymph nodes or tissues. Stage II, cancer has spread to lymph nodes in the chest and possibly to other structures. Stage IV, cancer has spread to other parts of the body, such as the liver, bones, or brain. Treatment: surgery. Lobectomy, removal of one lobe of the lung. Pneumonectomy, removal of an entire lung. Segmentectomy, removal of a segment of the lung. Radiation therapy, used to target and kill cancer cells, often used when surgery is not an option or to treat specific areas. Chemotherapy, uses drugs to kill or inhibit the growth of cancer cells. It can be administered before surgery, neoadjuvant therapy, or after surgery, adjuvant therapy. Targeted therapy, drugs that target specific molecules involved in cancer growth. Effective for cancers with specific genetic mutations. Immunotherapy, uses the body's immune system to fight cancer cells. It can be effective for certain types of lung cancer. Supportive care, includes managing symptoms and side effects, such as pain management, nutritional support, and palliative care. Prevention smoking cessation. The most effective way to reduce the risk of lung cancer. Avoiding secondhand smoke. Reducing exposure to secondhand smoke can lower risk. Reducing exposure to carcinogens. Using protective measures if working with substances like asbestos or radon. Regular screening. For high-risk individuals, such as heavy smokers or those with a family history of lung cancer, regular screenings with low-dose CT scans may be recommended. Conclusion: lung cancer is a serious condition with various treatment options depending on the stage and type. Early diagnosis and treatment are crucial for improving outcomes. Consulting with healthcare professionals and following recommended screenings and preventive measures are key to managing and reducing the risk of lung cancer.